Great. A very good morning to all of you. I hope you can see me and also see my slides as I speak. That is hopefully the aim. Perfect. Thank you very much for having me to speak with you today and for organizing this conference as well on what I think is such an important and like under-discussed and understudied issue. I'm going to be speaking about my research on long COVID in children. To give you a background to myself, I am in international human rights law by training. So I research this issue from a human rights law perspective, but I'll be sharing, I guess, a sort of interdisciplinary perspective today, and hopefully speaking about the law in a way that is accessible for our attendees today, being such a cross-disciplinary audience. I will also preface this by saying that my research has been conducted in the context of the United Kingdom, because that is where I was working at the time that I started conducting this research. I'm obviously based in the United States of America now at NYU. So I will begin by talking about long COVID in children in the UK. And thinking about the implications of long COVID for children's rights. Obviously, the implications that long COVID has for children's rights in the UK are implications that are universalizable insofar as they have implications for children's ability to participate in their education, for example, or enjoy the right to health. I'll be talking a little bit about equality and non-discrimination law, and then I do want to make some brief remarks right at the end, specifically on the United States perspective as well, given that that's where I'm joining you from this morning, from a very icy and snowy New York. Obviously, we have quite a lot of political change in the United States right now, and that is going to have direct implications for children's health care and their ability to access preventative and curative health care. So I assume that many of you might have questions about the situation in the US in terms of healthcare generally, and specifically in terms of long COVID. So I'm going to maybe speculate, if you will, a little bit about some of the changes that might be on their way in the children's right to health space as relates to long COVID in the US. So I think it's a good thing to start by saying that UK policy responses to COVID in children generally have been very varied over the past years. During the pandemic, children were treated many times as vectors of transmission and barred from many areas of society. Sociologists have called this a kind of childist approach to COVID policy in the UK. And this saw, for example, children being banned from supermarkets for a very long period of the pandemic in parts of the UK. Of course, as we saw in many parts of the world, high rates of transmission of COVID within schools and child-to-parent transmission led to lengthy school closures as well. Conversely, and further into the pandemic, we also saw the deprioritization of children in policy responses to the pandemic. So when it was established that there were very low rates of hospitalization and death among children, we saw an abandonment in schools of testing, tracing, and isolation requirements within schools in the UK, which obviously increased the risk of children's exposure to COVID and ultimately, therefore, the development of long COVID as well. And this was coupled with relatively slow vaccination of children in the UK as well, given that the risk of acute illness from COVID was calculated to be relatively low among children. Now, we did see in the UK that for lengthy periods of the pandemic, children, and particularly those in schools, were actually testing positive at a far faster rate than any other group of the UK population. And studies in the UK indicated that anywhere between 14 and about 50% of children who had tested positive for COVID in the UK had later developed long COVID symptoms, and that there was no necessary correlation with the severity of the initial illness resulting from long COVID. These are obviously greatly varied and unclear statistics, but to think about the fact that anywhere between 1 in 10 and 1 in 2 children who tested positive for COVID in the UK later developed long COVID symptoms is a quite staggering statistic to think about in the context of our discussion today. So at 2022, which was when I wrote the paper that I'm basing this presentation on today, it was estimated that there were 115,000 children living in the United Kingdom with long COVID symptoms. At 2023, in the middle of the year, that estimation had dropped to 77,000 children in the UK living with long COVID symptoms. And no statistics have been collected on long COVID in the United Kingdom population in general since the middle of 2023. That in some ways makes it difficult for us to understand the exact severity and significance of long COVID in UK children. But in the paper I've written, I also make the argument that in many ways, the number of children living with long COVID in the United Kingdom shouldn't be the primary metric that we use to calculate its significance as a human rights issue. So from the perspective of human rights, the government bears as much of an obligation to understand and provide effective treatment for a condition that affects 1 or 2 people within the population as it does for a condition like influenza, for example, that affects millions of people on a yearly basis. The kinds of resources that they dedicate to understanding and treating the condition and the way in which they implement public health measures will obviously vary according to the extent of the population that is affected. But under human rights law, we say that the state bears an obligation to respond to health issues regardless of the significance of the size of the population or the proportion of the population that is affected. But I think it is nevertheless noteworthy that such large numbers of children in the United Kingdom have been affected by long COVID and likely still are. This is where I think it's then helpful for us to think about the ways in which long COVID specifically affects children's human rights. Obviously, the COVID pandemic, to begin with, had significant and lasting impacts on children's capacity to exercise their human rights. And it's important to understand this because in many ways, it's good to think about the layers of human rights implications that have resulted first from the COVID pandemic and then ongoingly from long COVID being so widespread among children as well. So we saw during the COVID pandemic, or have seen, a much higher likelihood of children's exposure to domestic violence during the COVID lockdowns. We've obviously seen disruption to education, and I'll come back to this later, because of the extent to which long COVID prejudices children's enjoyment of their right to education as well. We've also seen during the pandemic that children living in joint custodial arrangements in the United Kingdom have experienced much higher levels of precarity due to restrictions that we had in the United Kingdom on travel and households mixing with one another. And studies are now showing that this has had long-term developmental issues or implications for children in the United Kingdom as well who are living in joint custodial arrangements. Add to this the fact that many children in the United Kingdom have been exposed to the loss of a family member or the prospect of such a loss for the very first time in their lives as a result of COVID. So we've seen in the first instance here, the COVID pandemic have serious implications for children's human rights in the United Kingdom. Now, the extent of these human rights implications, I argue, amplifies the need for our consideration of a long COVID from a children's rights perspective, to think about the kind of long, medium, and short-term human rights issues that we're dealing with here. Now, for those of you who don't know, children's human rights are recognized in many international human rights documents, including first and foremost the UN's Convention on the Rights of the Child. Now, the UN Convention on the Rights of the Child has been ratified and signed by much of the international community. Now, when I say that, I mean that most of the countries around the world that are members of the UN have signed and agreed to be bound under international law by the UN Convention on the Rights of the Child, that they owe the international community under international law an obligation legally to abide by, to respect, protect, and uphold those human rights. Now, for our purposes in our discussion today, the signatories and ratifiers of this convention include both the United Kingdom and the Netherlands as well. The picture is much less clear and much more complicated with the United States, which renders this conversation that we're having today around children's human rights much more difficult in the US, but I'll get to that a little later on. Now, for the purposes of my specific research, it's also worth noting that the UN Convention on the Rights of the Child has been embedded directly into the domestic legal systems of Wales and Scotland under what we call the UK's devolution settlements. Now, this means that under Welsh and Scottish law, public authorities bear a very direct responsibility to act in correlation with and in respect for the UN Convention on the Rights of the Child in all decisions they make that might affect the interests and the well-being of children. So in Wales and Scotland, the legal systems demand a much higher level of compliance with children's human rights standards than elsewhere in the United Kingdom, and in fact, in many other parts of the world. We have legal regimes in Scotland and Wales that establish a particularly high bar for respect for the rights of children, which makes us think and hope that the responses to long COVID on a policy level in Scotland and Wales will in fact be rather robust. Now, in terms of specific children's rights, obviously the leading right that is implicated by long COVID in children is Article 24 of the Convention on the Rights of the Child, which recognizes the right of the child to health and specifically to the highest attainable standard of health. So the right to health doesn't require the state to ensure that everyone is healthy all of the time, but it does require the state to make sure that there is a healthcare infrastructure that allows all individuals, and in particular under the UNCRC children, to access the highest attainable standard of health through effective and functional preventive and curative healthcare services. Now, as a result of the jurisprudence of the UN Committee on the Rights of the Child and also the UN Committee on Socioeconomic Rights, we know that the right to health comprises various elements that are relevant to the rights of the child as they relate to long COVID. The very first one is community-based and preventive healthcare. Now, this requires on a very kind of basic level the development of behavioral and structural interventions like the promotion of good hygiene, distancing, ventilation, testing, isolation. And when I say this, I'm sure you'll know that among children, all of these measures are particularly relevant and important within a school setting. And obviously we've seen within the UK and around much of the world that most of these behavioral and structural interventions have now been abandoned. And of course, the only sort of foolproof way of preventing children from the risk of developing long COVID is to try ongoingly to reduce the rates at which COVID is transmitted within settings in which children are in close proximity to one another, such as in schools or in childcare facilities as well. Effective community-based and preventive healthcare will also include measures such as effective vaccination rollout among children. And I will note here, as I argue in my paper on the topic, that the UK informally did adopt this policy of herd immunity, of allowing children to be exposed to high levels of COVID in order for the development of herd immunity. This has obviously resulted in or may have resulted in particularly high levels of long COVID among UK children. And this government policy of allowing the development of herd immunity is inconsistent with this aspect of the right to health that requires structural and preventive healthcare measures to be in place. Equally, the right to health requires access to facilities for the treatment of illness and rehabilitation of health. So here we see that the right to health under the UN Children's Rights Convention also requires the state to ensure that there are facilities that can treat and rehabilitate children who are experiencing long COVID symptoms. Now, this first and foremost requires the state to ensure the availability of primary health care in sufficient quality and quantity. So the availability, for example, of general practitioners. It also requires the availability of quality treatment for long COVID that is based upon rigorous and scientific research. And I really want to emphasize this point. What we have seen over time in the United Kingdom, as you might have noticed from my comments, on the lack of statistics available even from 2023 onwards on long COVID, that the efforts scientifically to understand long COVID and its effects on the population in the United Kingdom have over time eroded. And much of the right to health, both for children and more broadly, requires ongoing and rigorous scientific research into the issue. And we have seen a waning of efforts around this in recent times. Now, long COVID also has effects on children's health or on children's rights more broadly as kind of knock-ons from its effects on their health. And in many ways, we know this also from the broader rhetoric that we see in the UN's kind of prism of human rights. So when we talk about international human rights law using the lexicon of the UN, we often talk about the indivisibility of human rights. So we talk about the fact that it's impossible for an individual to exercise any of their rights if one of their rights even is breached or violated or can't be enjoyed. And we definitely see this in the context of children's rights in long COVID. That as long COVID affects children's right to health, it also then has broader implications for their enjoyment of their human rights generally. Obviously, we see first and foremost the effects on children's rights to education. Long COVID symptoms in children directly inhibit their ability to participate fully and gain fully from their education. We have seen in the United Kingdom and in the United States some efforts to make arrangements for or accommodations for students who suffer from long COVID, but these haven't been consistent or effective. Children under the UN Convention on the Rights of the Child also have a right to participate in decisions that affect them. And we also see as a result of long COVID, the erosion of children's participatory rights, their abilities to participate in society to their fullest. But I also emphasize in my paper on this topic Article 27 of the UN Convention on the Rights of the Child, which protects children's rights to live in conditions that are sufficient for their physical, spiritual, mental, and moral development. Now, this right specifically includes the ability to establish and develop relationships with other human beings. And I hold serious concerns for the implications of long COVID on children's abilities to fully establish and develop relationships with other human beings around them. The kinds of symptoms that we see from long COVID, long-term symptoms that we all know and that we've been talking about today, these are the kinds of symptoms that may seriously inhibit children's ability to establish and develop fulfilling physically, spiritually, mentally relationships with the humans around them in stages of their lives that are developmentally crucial. And there is a need to think and respond to these potential implications much more robustly than the state is at this particular point in time. Now, as we all will know, studies have shown that long COVID disproportionately affects socioeconomically disadvantaged people, and that's particularly the case in the UK. And it also disproportionately affects people with underlying health conditions such as obesity and diabetes. Now, international and UK domestic law, such as the Human Rights Act and non-discrimination law, require public authorities to develop an approach to long COVID in children that is firmly rooted in these principles of equality and non-discrimination, to take into account and to be aware of and to act upon the fact that long COVID particularly affects individuals who are socioeconomically disadvantaged or suffer from underlying health conditions. Now, this again, first and foremost, will include rigorous research into how long COVID affects persons with protected characteristics. Studies have established that the UK population in general, we are seeing long COVID particularly affecting people with protected characteristics, but disaggregated data on children is not available on this level in the United Kingdom, and there certainly have not been robust studies in the United Kingdom about children with protected characteristics and the ways in which long COVID specifically affects them. What is also required under this aspect of human rights law is training for healthcare professionals to ensure that the best possible care is available for children long COVID patients, for example, with disabilities or linguistic disadvantages, language barriers, for example, or underlying health conditions. We know already that it is difficult for children to articulate, for example, symptoms that they are experiencing in a way that can allow healthcare professionals to provide them with the best possible treatment. And these issues may be even more acute in children who are, for example, from socioeconomically disadvantaged backgrounds. So there is a need here to ensure that healthcare professionals have the sufficient training to be able to provide the best possible healthcare for children in such situations. Now, lastly, I just want to provide a quick comment on the US perspective. As we all know, we have a new administration in the White House here in the United States. My background in this particular issue has predominantly been in the UK context, because that is where I conducted most of this research. But obviously, I have been involved in conversations in this area in the United States in the past few weeks as well. And of course, there remains considerable uncertainty as to the new administration's commitment to vaccination for children, for example, and more broadly to health security responses among the United States' children population. Where in the United Kingdom, we can make arguments around children's rights and long COVID in the context of international human rights law. I think the main battle we face here in the United States is that the US remains a bit of an outlier in the international human rights system. It is not a party to the Convention on Socioeconomic Rights, and while it has signed the UN's Child Rights Convention, it has not ratified it, which means that it is not fully bound by the Child Rights Convention under international law. It also remains unclear whether current programs to accommodate student disabilities in US schools, which in certain parts of the US, like New York State, include accommodations for children who have long COVID, will face legal challenges under some of the new policies that we're seeing coming out of the White House right now. So whereas we can sort of chart a path forward within the United Kingdom and also in the Netherlands under international human rights law as relates to long COVID in children, the conversation here in the United States is much more complicated. And I think there is a bit of a wait and watch situation here with that. But if anyone has specific questions about the US and what's happening here, I would be very happy to take those in question time as well. For now, I will leave it there. Thank you so much again for the invitation. I'm looking forward to our conversation going ahead.